Hey, this is Kim Sikorsky with Liberty Medicare Advisors, and I want to thank you for joining in to watch this video. I created this video for people turning 65 and that are new to Medicare to help you understand what your Medicare options are and to help you navigate the Medicare maze. So before we get started, I'd like to talk about what we'll cover. We're going to talk about Original Medicare, the 4 parts, what they are and what they do. Your 2 choices to get coverage for what Medicare does not cover. That's going to be Medicare Supplement or Medicare Advantage. We'll talk about exactly more in depth what Medicare does cover. We'll discuss what a Medicare Supplement plan is and how to compare them. We'll talk very briefly about Medicare Advantage plans and how to compare those. We'll talk about Part D prescription drug plans and also important enrollment dates. So just a little bit about myself. My husband Dan and I have been married for 23 years. We co-founded Liberty Medicare Advisors together. I have been licensed since 2008 and I've been an independent broker that entire time. I am currently licensed in all of the states that you see, and I believe I have added a few more since then, so I do need to update that list, but we do business in many states around the country. Okay, so a few of the benefits I offer. I am non-biased. So what that means is, as an independent broker, I have no loyalty to any particular insurance company. And this means I will always provide you with an unbiased recommendation of the companies I feel best suit your needs. I'm your advisor on the ground. So if you have to make any changes to your policy, you can always reach out to me rather than waiting on hold with customer service at the insurance company. And if you have any Medicare related questions, please always feel free to reach out to me. I am your resource for all things Medicare, and I assure you I will always respond to your questions. This is a very important topic here. Review your coverage every year. So we will take a look at your Medicare Supplement plan on its annual renewal date to take a look at any rate increases you may have received. Take a look and see if we need to maybe look at another company or if you're good staying where you're at. With Medicare Part D, we will also look at your coverage every year. In the fall of every year you will receive what's called an annual notice of change, or an ANOC, and that'll outline what plan changes are coming in the following year. So we'll sit down, take a look at those changes, take a look at your current drug list and see if your plan is good or if we need to make a change to another company. Do the exact same thing if you have a Medicare Advantage plan. Every fall you're going to get that ANOC, the annual notice of change I just mentioned, and we'll take a look at the plan benefits, your doctors, your drug list, and make sure that it's still a good fit for you. If not, we'll look at the plans that will be coming available and make that change. So when you can make these changes. With Medicare Supplement plans, you can make a change anytime during the year as long as you qualify for underwriting. With Medicare Part D and Medicare Advantage plans, in most cases those plans will be changed between October 15th and December 7th of every year during the annual election period, and then those plans go into effect for January 1st. There are some exceptions to that rule, such as if you move out of your network area, but we won't go into detail on those right now. If any changes occur, you always let me know and we will work through that and make sure that you get what you need. Last but not least, there is absolutely no cost for my help. If an advisor, broker, agent tries to charge you a fee for their services, run, not walk the other direction. That is not somebody that you want to do business with. Like I said, myself and many other good brokers out there always provide our services at no cost to you. Okay, let's talk about the basics of Medicare. You've got your 4 parts. You've got Part A, which is hospital insurance. This is exactly what it sounds like. This is your coverage when you are admitted to the hospital as an inpatient. Part B, medical insurance. This covers things like doctor's visits, any type of service performed on an outpatient basis, such as blood work, X-rays, MRI, CAT scan. Medicare Part C is Medicare Advantage. These are typically HMOs or PPOs. They include Medicare Part A and Part B, and in most cases include Part D drug coverage. We'll talk a little bit more about that later. And then last you have Part D Medicare prescription drug coverage. So you'll want to decide how you want to get your coverage under either Original Medicare or under a Medicare Advantage plan. With Original Medicare, you'll have Part A, which is your hospital insurance, and Part B, which is your medical insurance. You'll want to add a Medicare Supplement insurance plan to pick up the hospital co-insurance and Part B expenses that Medicare does not cover. And then you'll want to add a Medicare Part D prescription drug plan. We'll talk more about that further, but you will definitely want to add a prescription drug plan when you first enroll in Medicare, even if you're not taking any drugs. Your other option is to get a Medicare Advantage plan, which is Medicare Part C. Again, that is either typically an HMO or a PPO. Part C combines Part A and Part B, and in most cases, Medicare Part D. Okay, let's talk about original Medicare Part A. Part A is your hospital insurance. This covers for inpatient hospital stays, skilled nursing facility stays, and also for hospice care. You become eligible at age 65. Typically, Part A is premium free as long as you or a spouse have worked for 10 years or 40 quarters. It does work with any hospital that accepts Medicare nationwide. So I want to give you an example of how Part A works, how the deductible works. So if you were admitted to the hospital on January 1st and you stayed for 5 days, you would pay $1,364. You are discharged from the hospital, you go home, you have no health issues, everything is fine. Fast forward to say April 1st and you have another health concern and you're admitted to the hospital. That $1,364 deductible resets and you will owe that again going forward. Something to be very clear about as well, with Medicare Part A, there is no maximum out-of-pocket cost or no cap with original Medicare. This is where having something like a Medicare supplement plan, or in some cases even a Medicare Advantage plan, will come into play to help you manage those costs. We're going to go into that a little bit further down the road here. Under Medicare Part B, this is your outpatient services, doctor's visits, all of those things are covered under Medicare Part B. So you become eligible at age 65, but you may be able to delay taking Medicare Part B if you are still working. There are some specifics, but in most cases, if you're working for a group that has 20 or more employees, you can delay Medicare Part B as long as you have group coverage. The premium for Medicare Part B for 2019, the standard premium is $135.50 a month, but it could be higher depending on your income. Please feel free to reach out to me in regards to that. I do have the chart from Social Security that shows how those payments work in regards to your income. So Medicare Part B does work with any doctor or facility that accepts Medicare nationwide, so you're not subject to a network. Medicare Part B also carries a deductible of $185. That is an annual deductible. So after you would pay your $185 deductible, Medicare pays 80% and then you owe 20% coinsurance. Additionally, if you were to see a doctor that does not accept Medicare assignment, they may charge you an excess charge. One more thing I want to make clear again, there is no maximum out-of-pocket or cap with original Medicare. This applies to Medicare Part B as well. A Medicare supplement plan in most cases is designed to pay the 20% coinsurance that Medicare does not cover and also help to cover any of those excess charges. But going forward, I don't want you to get too worried about excess charges, because last time I checked, I believe it's something like 96% of all providers in the United States accept Medicare, so excess charges shouldn't be that big of a deal, but it's something to be aware of going forward depending on the plan that you may choose. There are some services that Medicare does not cover, and these services include dental, vision, and hearing. The great news is there are many affordable options that we can look at when designing your Medicare coverage that will help to cover those costs. Because Medicare does not cover 100% of your expenses, many people opt to take a Medicare supplement plan, also known as Medigap. A couple of important facts: to get a Medicare supplement plan or a Medigap plan, you must have Medicare's Part A and Part B. You will pay a monthly premium for your Medigap policy in addition to your Part B premium. Medigap or Medicare supplement policies cannot include prescription drug coverage, so you will need to add Medicare Part D coverage. We'll talk about that later. Costs will vary from company to company and from policy to policy, and they may increase in premium as you get older. Something important to note: when you first turn 65 or enroll in Medicare Part B, whichever comes later, you have 6 months to choose a Medicare supplement plan without answering any health questions. This is called your open enrollment period, where you are guaranteed coverage. The insurance company must sell you any plan that they offer without any medical underwriting. After those 6 months are up, insurers can ask health questions and they can decline your application if they wish based on the results of their underwriting. One of the positive things about Medicare supplements is you have your choice of doctors, hospitals, providers anywhere in the nation that accepts Medicare. And like we talked about earlier, I believe it's something like 96% of all providers in the United States accept Medicare. The coverage is also standardized, which means that companies can only sell you a standardized plan. These are identified by letters. There are 10 letters currently. We'll talk about the 3 most popular plans next. What this means, though, is that different companies can charge different premiums for the exact same policy. So when you are looking at a Medicare supplement plan, it's important to know that the policies are all the same. The only thing that is going to vary is the premium that you're going to pay for it. The 3 most popular Medicare supplement insurance plans are plans F, G, and N. And looking at the chart here, plan F is the most robust plan. It covers 100% of the expenses that you see here, including your Part B deductible of $185 for 2019. Plan F also carries the highest monthly premium. Looking at plan G, which is a very popular plan, it pays exactly the same as plan F, but you pay your Part B deductible, which again is $185 for 2019. It carries a lower premium than plan plan F, making it very attractive. Plan N is similar to plan G, a few differences there. While it does pay 100% of the Part B coinsurance, you can pay up to a $20 copay for office visits and up to a $50 copay for emergency room visits that do not result in an inpatient admission. Also, you will pay your Part B deductible, and Part B excess charges come into play with Plan N. If you do see a provider that does not accept Medicare assignment, they can charge you those Part B excess charges. As I mentioned earlier, the majority of the providers in the United States do accept Medicare assignment, so this should not be an issue. There are ways that you can check to make sure a provider accepts Medicare assignment, so you do not have to worry about those Part B excess charges if you choose to look at Plan N. So of the 3 plans, Medicare Plan F carries the highest premium. Plan G, because you pay your Part B deductible, carries a lower premium, and even lower yet is Plan N if you're willing to take on a little bit more of the cost sharing. That being said, historically Plan F has had the highest rate increases, where Plans G and Plan N have had lower, more stable rate increases. Okay, this is a schedule of benefits that illustrates how Medicare pays in conjunction with the Medicare supplement plan and what you pay. So for the purpose of this video, we're going to look at Medicare Plan G. So if you look in the first column, it shows what Medicare pays. The second column shows what Plan G Medicare supplement pays. And in the third column, it shows what you pay, which is essentially 0. This is for Medicare Part A hospital services. Plan G for Medicare Part B, which is medical services, your doctor's visits, diagnostic tests, outpatient medical services. So basically, when you're looking here, you can see Medicare, what Medicare pays, what your Plan G pays, and what you will pay. Under Medicare Plan G, you would be responsible for paying your Part B deductible. Then the plan covers that 20% that Medicare does not pay. And if you note here, this shows the plan as paying, the Part B deductible is being $183 for the year. It is actually $185 because it is 2019 when this video is being made, and this slide needs to be updated. So again, Medicare would pay 80% after the $185 Part B deductible is paid by you. The plan would pay the 20% that Medicare does not cover, and you would pay 0. Looking at Medicare supplement plans, they are literally compared as apples to apples. One company is going to charge a completely different premium from another company, though the plans are standardized and they all have to pay the exact same way. When we look at Medicare Advantage plans, it's a little bit different. You are not comparing apples to apples. You are comparing grapes to pineapples and every variation in between. Different plans are going to have a different monthly premium. They're going to have different doctors networks, drug formularies for Part D, which is built in most cases to Medicare Advantage, can vary tremendously. You're going to be looking at different copays for services and out-of-pocket limits. The plans can change every year. It's just a whole different animal altogether. That being said, let's take a look at a Medigap policy versus Medicare Advantage. With a Medigap policy, you enjoy no networks. You have your choice of providers nationwide. With Medicare Advantage, typically you have a network of doctors and hospitals that you must see, or you will pay much higher out-of-pocket costs. Medigap policies have predictable out-of-pocket costs because you are not subject to all of those copays and deductibles that you see here under Medicare Advantage. With a Medigap policy, you will enjoy having no referrals. With Medicare Advantage, referrals are usually required for most services. With a Medigap policy, the plans renew annually. You cannot be canceled as long as you pay your premium every month. With Medicare Advantage plans, the plans can be changed or dropped on an annual basis. Every fall you need to take a look at the plan and make sure that it still suits your needs, or that the plan has not made significant changes or is being dropped altogether. With Medigap policies, the plans travel with you around the country, giving you the option to see doctors and providers around the country. With Medicare Advantage, the plans are in most cases dependent on a network, and you do not have the ability to travel with the plans as you do with the Medigap policy. You will want to add a Part D prescription drug benefit plan if you choose to go with the Medicare supplement plan. These plans are regulated by the government but are offered and administered through private insurance companies. Important facts to know about Part D: the prescription drug plans will have a monthly plan premium, and some plans have an annual deductible. Not all plans have an annual deductible. The prescription drug benefits work off a calendar year that runs from January 1st through December 31st. The plans use a formulary, which is a list of individual drugs covered by the plan. The formulary has tiers, typically tiers 1 through 5, with tiers 1 and 2 being the lowest tiers with the lowest cost share, with tiers 3, 4, and 5 having higher co-pays or co-insurance associated with those tiers. The plans can impose something called prior authorization or quantity limits. Some drugs will require your prescriber to contact the drug plan before you can fill certain prescriptions. Your prescriber may need to show that the drug is medically necessary for their plan to cover it. Quantity limits also say how much of a medication you can get at one time. Step therapy can also be a factor. It would require you to try one or more similar lower cost drugs before the plan will cover a higher priced prescribed drug. Let's talk about how the payment stages work. So in the initial stage, that would be the deductible stage, you would pay typically the full cost of your drugs up to the deductible amount if your plan does have a deductible. With some plans, drugs that are on tiers 1 and 2 are not subject to the deductible since they are a lower cost drug. Then you enter the initial coverage stage. During this stage, the plan pays its share of the cost, and you pay a copayment or co-insurance for each prescription you fill until your costs reach $3,820. This is for 2019. Again, the slide needs to be updated. So then you enter the coverage gap. During this stage, you receive limited coverage on certain drugs. You'll get a discount on brand name drugs and generic drugs. This stage continues until your yearly out-of-pocket costs reach $5,100 for 2019. Once you reach that phase, you move into catastrophic coverage. In catastrophic coverage, you pay only a small co-payment or co-insurance for each prescription that you fill. That being said, most people do not reach the coverage gap or catastrophic coverage. It does happen for those individuals that are taking higher cost drugs, but in most cases, most people see themselves in the deductible phase or in the initial coverage phase. Lastly, let's talk about some important enrollment dates. For a Medicare supplement plan, you may enroll in most cases in a plan up to 6 months prior to your Part B effective date. this is actually a great option because this allows you to lock in your price for your Medicare supplement plan 6 months prior to your effective date. So if there is a rate increase, you've locked into that plan and you will not see that rate increase. You have from your Part B effective date another 6 months after to enroll. Once that enrollment period is over, you may have to answer health questions, which means that you could pay a higher premium or be denied coverage altogether. Medicare Advantage and Part D, the dates are similar with Medicare Advantage and Medicare Part D. You can enroll 3 months prior to your Part B effective date, the month that your Part B goes effective, and then the 3 months after. I want to thank you for taking the time to watch this video. If you have questions regarding enrolling in Medicare or need help designing your Medicare coverage, please feel free to reach out to me. I would be honored to help you navigate your Medicare options. You can reach me again at 1-800-791-6850 or email me at kim@libertymedicareadvisors.com. Again, this is Kim Sikorsky with Liberty Medicare Advisors, extending a thank you to you for watching this video, and I look forward to hearing from you real soon.